Daniel, how do we get all the people? How do we get all the people?
Where's that button there? Push it. H. So, they can hear everything you say.
Yeah.
Have we heard from Cindy Chicker or Ingrid yet?
I have not heard from anybody. I don't know, Angie, have you gotten anything?
Okay. Well, Ingrid just joined, and I see Van just joined a little bit ago also, so we have a quorum now.
Hi, I apologize. I had to run here from school.
So I would like to call this meeting of Health and Human Services Board together on Thursday, April 8th of 2021 at 10:33 a.m. Was there affirmation of public notice?
Yes, there was.
Wonderful. With that, we have a 13-point agenda. Looking for a motion to approve our 13-point agenda.
I make the motion, Deborah Kaiser.
Second, Van.
Motion by Deborah Kaiser to approve our 13-point agenda, seconded by Supervisor Nelson. All those in favor signify by saying aye.
Aye.
Aye. Opposed, say nay. Motion carried. Approve our minutes of the March 11th, 2021 Health and Human Services Board minutes. Are there any additions, corrections? Hearing no additions or corrections, I'll declare that those minutes be approved as presented. Number 3, citizen comments. Is there any citizen comments? Do you have any citizen comment? Hearing no citizen comments, we'll move on to agenda item number 4, the director's report. Tracy?
All right, thank you. I'll start with some program information with Behavioral Health Services. The birth to 3 staff are working with the local medical and school districts on the child find activities to increase awareness for birth to 3 services. Birth to 3 staff are also in the process of completing the annual review with the state. The annual review focuses on the program's interactions with families and early childhood development skills for children who are enrolled in the service. Our substance abuse treatment staff are working with Partners for Prevention and local law enforcement to support the local drug take back day, which will take place on April 24th. Sources of Strength program, which is provided by school mental health staff, has been highlighted on the WRC morning show in March and April and will be the focus again in May. Sources of Strength is a youth suicide prevention program that draws upon community strengths to increase youth supports and decrease youth suicide. Local students and those who support students are participating in that program. With Child and Youth Services, our staff continue to see an increase in abuse and neglect reports. The staff in Child and Youth are working on several new investigations at this time. April happens to be Child Abuse Awareness Month. I'd like the board to know that we're extremely fortunate to have caring, high-quality staff working every day to keep children safe and to strengthen families in our community. In economic support, as I've stated previously, economic support programs continue to operate differently in response to the public health emergency, with more relaxed requirements for food share and Badger Care and Medicaid. If individuals are found ineligible for Badger Care or Medicaid, they can still apply for insurance through the federally facilitated marketplace until May 15th at healthcare.gov. As of the end of March, the Wisconsin Home Energy Assistance Program, or WEAP, has assisted 668 households with their heating bills. This is a 3% increase from the same time last year. The moratorium on utility disconnections will end on April 15th, but there is crisis funding available that can be used to prevent disconnections and help with LP fills. And finally, with economic support, Southwest CAP has assisted 7 Richland County households through the Wisconsin Emergency Rental Assistance Program, or WERA. Households seeking assistance can still contact Southwest CAP as long as funds last. In the ADRC, our disability benefits specialist, Jody Hines, will be participating on one of the training panels for the statewide annual skills training that all DBS staff must complete. And our elderly benefits specialist, Joanne Welsh, is seeing a really large increase in requests by people planning on retiring who want to receive the Welcome to Medicare presentation. Due to COVID, these have been done on a one-to-one basis instead of in the monthly group presentations that we usually do. The ADRC is also offering numerous online dementia care events, including a virtual book club with the dementia care specialists. The April book is called On Vanishing, Mortality, Dementia, and What It Means to Disappear. Also being offered is a new virtual health promotion program called Savvy Caregiver, which will start April 15th and will be held one morning a week for a 7-week period. The program helps family caregivers acquire strengths, knowledge, skills, and attitudes to empower them to care for their loved one. And finally, a Boost Your Brain memory course will start in May. This is an 8-week course, whole person program focused on brain fitness. And with some agency-wide news, we have begun our planning to reopen the community services building. All of our staff who wanted to receive the COVID-19 vaccine have now received at least their first dose. So roughly 70% of our staff are vaccinated, and staff have continued to remain safe from the virus with no one testing positive since last November. Our target date for reopening will be Monday, May 3rd. We'll continue to conduct health screenings and ask everyone coming into the building to wear masks and practice social distancing. It should look a lot like when we reopened previously. When we get to the adjournment on the agenda today, possibly the board will want to discuss continuing Zoom meetings or returning to in-person meetings. In other agency-wide news, the roof replacement for the community services building is scheduled to begin April 19th and will take approximately 1 month as long as we don't have any weather or other delays in the process. They were actually supposed to start, I think, this week, and this is the second delay that we've seen. In order to continue supporting our ability to provide vaccines to the community, we will be hiring some additional limited term staff to help with the vaccine clinics. This will include both registration and nursing staff. And before I complete my report, I'd like to let you know that it is also National Public Health Week this week. The theme is Building Bridges to Better Health. Making communities safe and healthy is public health's top priority, and COVID-19 has especially highlighted the importance of local public health departments. I'd like to take this opportunity to also recognize the significant dedication and commitment by our public health nurses and staff in responding to the pandemic emergency. They've consistently put in long hours with little time off over the last year in order to keep Richland County safe. So thank you to all of our public health staff for the work that you do. And that's my report. Any questions for me?
All right, thank you, Rose, or Tracy. Rose, thank you for being our public health nurse, and all of your employees that work underneath you. Do a great job.
Very welcome. Thank you so much.
With that, we'll just give you the floor right now, and you can give your health officer update.
And thank you so much, Tracy, for those kind words and for recognizing public health nurses during this, our Public Health Week here in April. And I'd like to thank all of the staff who have supported us. Our public health nurses definitely have been on the front lines, but without the support of all of the individuals, especially our staff here from Health and Human Services, we would have been so compromised we couldn't have been able to operate as effectively or as efficiently as we have been. So I am so grateful, and I appreciate all the support that they provided to us here in public health as well. As far as news in public health, it's important to know that over the last couple of weeks here in the state of Wisconsin, there's been an uptick, or the numbers of positive cases of COVID-19 have been trending up. I know that even in the first couple of days of this week, we've seen probably 15, 16, we've had closer to 2,000 cases in several days than we've seen in a long time. At one point, we had gotten down to almost a couple hundred cases a day, which was a real small amount. But now we're seeing 800, 700, 500 new cases a day here in the state of Wisconsin. We've seen a slight uptick here in Richland County. Overall, our positive case numbers have remained essentially flat. However, even 1 or 2 or 3 more a day actually does represent an increase. And that is demonstrated in the statistics and some of the graphics that we see on the Department of Health Services website. We actually have been operating at about a moderate level of positive case activity, but now we're back up to high. I will admit that limited testing numbers does possibly skew that a bit. So when you look at the numbers of folks being tested versus those who are testing positive, that can definitely have some influence on that perception. Right now, we have 11 active cases, and that's a significant decrease from where we were at our heights. However, that is more than we've seen in a while as well. Again, our major focus right now is vaccine administration. And on Tuesday and Wednesday, we administered 450 vaccines at the Richland Center Community and Senior Center. In the statistics that I brought up at the end of last week, Public Health had administered 2,070 vaccines to individuals. That's in total, not just necessarily those here in Richland County. And if I take a look at those, and you'll see that in the press release that has been or will be released or already has been, here in Richland County. And again, this information comes directly from the Department of Health Services website, and I stole it shamelessly from the email that Tracy sent this morning, just because it saved me time, and I sure appreciate it. Here in Richland County, when we're looking at our entire county as a whole, 35.1% of individuals have received at least one dosage of COVID-19 vaccine. And those who have completed the series are at 25.4%. For those individuals who are equal to or greater than 65 years of age, 76.2% have received at least one of their first dosages or one dosage of COVID-19 vaccine. And those who have completed the series are 68.6%. So I'm so happy and thankful that we're establishing these benchmarks. And hopefully as a group, we're here in the county establishing more bench strength, so to speak, with keeping folks safe. As I tell the folks that I meet with from day to day when I'm administering vaccines, we certainly appreciate their commitment to keeping themselves healthy, their families healthy, and then the greater community in which they are residing. However, we fully know and appreciate that if you do not contract COVID-19, variants and mutated strains do not develop. There is not an opportunity for that strain or for that disease to actually mix inside an individual or in another species to create a variant. So by getting a COVID-19 vaccine and by being able to prevent the acquiring the disease, we reduce that issue with variants and mutated strains. So it's a bigger picture item too. It's amazing how much influence one vaccine can have on an individual and the greater community. So just wanted to put that out there for folks.
All righty. Is there any questions for Rose? All righty, we'll move on to our next agenda, item number 6. Review and approve Health and Human Services vouchers.
All right, can you all hear me? So on the first page, we have $30,000 and $441.81. The first page after that, as well as the second and the third, are the mileage reimbursements for the transportation program, like we typically see every month. Going to page 4, the very first two at the top, those were our bills for February. The first one is for February, and the second one is for March. Snow plowing. So that wrapped up the year should be wrapped up the year, right, Angie, for our snow plowing bills? I believe.
I hope so.
Okay, just checking. So then moving on to the bottom two actually on that page, they're actually from the rest of that page is our credit card bill. But the only two I'm going to highlight are the very bottom two ones because the other ones are routine charges. The 179 is for our nutrition program manager to take a course on food safety. And the very last one is purchasing for the transportation program, coolers and organizers for the drivers, for the buses and whatnot. Moving to the next page, page 5, with CWD or CDW, that was a wireless headset for one of our COVID/vaccine staff. Lines number 28 and 29, so it's the third and the fourth line down. There are two Conference fees for two of our child and youth services staff to attend a conference on prevent child abuse. And the one right below that, number 3, the truck repair and maintenance for fillbacks. This is for a nutrition program for vehicle repair for the Dodge Caravan. And 2 more to note on this page, 26 and 27. So a total of $2,312. This was for a computer for to replace when we had a transition in staff. We're going to be having a new position in CCS open. This is for a computer for that position. And then moving to page 6, I've got just one to note on this page, the second one down, line 30. For $250, this was Prime Solutions workbooks for our AOTA program. And then moving, well, actually the very last one on this page, all the way to the next page, are the observer, is our observer bill. And for a total of the middle of the page there, Tracy, $757.22. And we had a lot going on this month: the public health nurse, the INA specialist position, secretary position, and a thank you for mask wearing and social distancing ad we put out, and encouraging people to still continue those practices, kind of ad. So then the shopping news is directly below that, all the way into the next page for a large total of $4,531.80. Somehow we did not get the shopping news bills, and so this is for January, February, and March. And we also had a lot going on. We had ads for temp drivers for the ADRC. These are January bills for economic support positions that were open. Another ad for that Stop the Spread through COVID. We have 3 open behavioral health positions and a secretary position. So, but that was January, February, March. So a lot going on with that. And then moving to page 9. Just 2 I want to mention on this page, 532.56, so line 56, 4 down. Washera County Human Services, they actually somehow paid for one of our staff to attend a certified peer specialist training for treatment court, so we're reimbursing them for that cost. And then 2 down from that, with Words Plumbing and Heating, we had a $75 furnace repair bill. And then 1 to note on the next page, to Corcoran Healthcare, the previously paid vouchers, very first one on the page, $258.62. This is for TB skin tests. So a lot of notable ones, I guess, this month, but just want to highlight things that aren't routine like I typically do. So any questions?
All right, hearing no questions, we'll move on to agenda item number 7, our budget summary and placement report.
We got to approve vouchers.
Oh, you're right. Motion would be appropriate to approve our vouchers.
Yeah, I'll move to approve the vouchers.
Motion by
Second.
Dr. Barris, seconded by Supervisor Glassbrenner. Is there any further discussion on our vouchers? Remember at the end of this meeting to send an email to Robin stating that you approve our vouchers, so we can get that off in Victor's office. All those in favor signify by saying aye. Aye.
Aye.
Those opposed say nay. Motion carried. Now we'll move on to agenda item number 7.
All right, you guys can all see the first report of 2021 up in front of you with a lot more information this month. No, we just chose to leave some comparative data on from prior years when we were entering the new budget. This typically isn't something we're going to go over every month, but just for more information, we thought we'd share that. As you can kind of just looking through it right now, see that there's just not a lot of change from 18 and 19 to 20, short of like in 2020, the biggest change was the growth in the CCS program. But what I do want to highlight in 2020 and just talk about, or 2021, excuse me, and Tracy can maybe scroll over so you guys can see where I'm talking about, is where I've highlighted in like there's a light orange color. I just want to, those are lines I've identified that have grown from past year, and I just wanted to quick walk through the whys so you guys have a little perspective behind that. So maybe Tracy, under building and operations, highlight that 306, 358. So that number grew from last year, but it only grew because we didn't budget $30,000 for general liability insurance in previous year. We get charged that every year. It just got missed in the 2020 budget. So that's the only reason that number increased. For public health, we added the public health nurse as well as COVID expenses this year. For economic support unit, we added additional expenses, but that was basically to meet our maintenance of effort cost. So it doesn't change any of the reimbursement or not. We get still reimbursed the same amount. There's the same tax levy in that program. So there's no positive or negative result to the finances of the county by that number changing.
Robin, would it be fair to say when you say we added expenses, it's not we added new expenses, we shifted expenses over to that line? Is that fair to say? We didn't create, there aren't new expenses.
No, there are new expenses there. So for child and youth, this is to reflect the additional allocation that they'd given us last year. So we had, I think, added another position, so that reflects that. And then mental health outpatient. That reflects, I think, the growth in the crisis services this year, as well as the APS crisis new position. So then you can see our utilization is at 19%. I looked back a year ago, we were at 19% as well. I know starting off the year, we're sort of slow at getting some invoices in. I know there's quite a bit outstanding right now. I think the only one I would really wanted to highlight is the public health. We're getting close to that 25%. It's at 24.5 right now. So watching that number closely, I think is going to be important, but I guess I'm not super concerned about it because we also have additional funding for public health this year. So,
pardon me, Robin, I just want to also point out with public health, we didn't budget for some of the additional staff that we have hired for public health. We didn't plan on that in our budget, but we do have funding coming in from the state. And then with some of the new federal money that will cover the cost of that. So we anticipated being able to cover those additional needs that we have in public.
Right, so I totally anticipate that we will probably exceed utilization for that reason. Just one other comment I wanted to make, if your numbers comparing person like me, the 2021 budget does reflect that we did take $120,000 reduction on the tax levy. We had just found secured additional revenue sources in some cases and reduced expenses in other cases. But that I just wanted to state that I did reflect that. Does anyone have any questions, I guess, on this first table? I know there's a lot of information there.
All right.
Okay. Moving forward, revenues, we've received some revenue. We've got a lot of billings out there where actually the anticipated revenue is higher. We've got some specifically with one of our programs where they're a little bit slow on reimbursing us. So we do have a little bit more hanging out there, but that will be coming in soon. So a total of 1.459 million in expenses, or in revenue, excuse me, and 1.487 expenses. That leaves us prior to a chargeback at a negative 27,928. After we would charge back February and January's Winnebago charges, we'd be left with a positive $16,461. And very positive to see that March is trending well for our Winnebago charges at 7,800 as well. So we have 2 good months now, I think. So while that 16,000, I know we've mentioned that before, really at a budget almost 700 million, it's sort of like breaking even, I would say. So there's just a lot of year left to I would say predict what that number is going to be like. But any questions on that before
Yeah,
Tracy?
Robin.
Yeah.
On the revenues, the anticipated and received, so they don't equal the total on top. Is there some other numbers coming into that revenues or what?
Oh, did you find it here? Hold on, let me quick pull it up and see. Oh, yes, I'm sorry, and I'll make a correction for this next month. So the way we bring our, I should have put that in the received revenue column. The way we, so actually we received 459,000 plus our $800,000 in tax levy. It's 820, I think, something. And the way we do it is we divide it by 12 and we add 3 months worth of it to the total revenue. So I missed adding the tax levy into the received revenue column. Does that make sense?
So
Okay.
I don't know, so if I'm following this right, so these 2 numbers here, the
No,
7
it adds up just short of the tax levy.
don't add up to this number. Is that what you're saying, Dr. Veras?
Yes,
Yeah,
but the tax levy should be added on to that.
and I have the tax levy added in, or calculated in the 1.4, but I did not add it to the received revenue, so I'll correct that for next month.
Good catch.
Yeah. I look so hard for these addition errors every month, and you catch that one. Good job, though. Okay, if nobody has any other questions, Tracy can move forward with the placement report.
Okay, so just 2 months of placements to be able to show you right now. In adult institutional placements, the placements were down a bit compared to January, which was an unusually high month. But we did receive some payments, so you'll see this negative $6,622 because we did get some payments or reimbursements back. Those generally are due to insurance payments that come back in to cover some of the cost of those placements. So with adult crisis stabilization, so far for the first 2 months, we have expended $17,205. And for adult institutional placements, we are at $44,380. And then with our adult community residential placements, again, for 2 months, we have $128,943. Just a reminder that that is high primarily because of that one extremely high cost placement where we have a CCS client. And this is the year when we do our reconciliation, we will get some reimbursement beyond what Medicaid had paid for us from last year. So there will be some payment that we anticipate toward that, but we don't know exactly how much that will be yet until the reconciliation is done. So for a total of adult placements, we have 190,527, leaving 291,751 in that Fund 54 or the Adult Placement Fund. And then looking at child placements for institutional, we had 49,000 even in expenses for institutional placements, and in the detention line, 17,425. And then with child foster care and treatment foster care placements for group home and treatment foster care, we had 58,663. And regular foster care was 4,576. So a total of child placement costs was $129,664, leaving $397,677 in that fund. Does anybody have any questions on the placements? After we have, I've given you some comparison documents in the past, and with only 2 months to try to project out what 2 months looks like, it's not a very good projection. And so next month we will provide you with those that comparison document as well, so that you can kind of start looking at what projections are looking like based on our expenses.
All right, does that complete your report then?
Yes, thank you.
Are there any questions? The placement report? All right, we'll move on to agenda item number 8, our contract monitoring.
Okay, good morning. So looking at the contract monitoring report, this is the first report you'll see for 2021. Not a lot of bills have come in, but mostly January and February. So I did look at a February utilization percentage, which was 17%. So these are all the new contract providers for 2021. Some have carried over from last year, some are new. So on the far right-hand side where it says percentage utilized, that's where I'm looking for if anyone's over 17%. And unfortunately on the first page, there are quite a few. So we'll start at the top, Southwest Wisconsin Workforce Development Board. That is that contract that we have for our leased employees that we had talked about the last few months. It's at 27% utilization. And we had mentioned that if those leased positions that we have targeted, I think there's 5, do not transition to county positions in the next month or so, that we will need to amend this contract amount as well. But if they do transition to county employment in the next couple months, this should ride out and be okay through the end of the year at $230,000. It's hard to predict though, because we are employing a lot of, as Tracy had mentioned earlier, leased part-time LTE staff to help with the pandemic response. So how this fluctuates will be better noted probably by October, I would think. Then we'd have a better idea of where exactly we're going to be with this. The next one right below that is a new family services that is overutilized. I don't know if Jess, if you have anything to say with that one.
I think that this is a youth that's already transitioned home in the month of February. So it was a contract that we started last year to get us through a couple months, and then a couple months this year, and then the youth has transitioned home.
Perfect, perfect. So let me go 2 more down from there. There's the Children's Hospital of Wisconsin at 30, almost 37%. Jess, I know if you want to respond to that one as well, that one's pretty high.
That one, I just saw that number, so I'm looking into it now. It may just be that we have more youth placed in that. It's a treatment foster home agency. We may have placed more children at the end of last year and are exceeding that for quicker than I had anticipated.
And then 2 more down from that is Community Care Resources. Again, Jess, 37%. Any thoughts?
Again, it's a treatment foster agency, so some of that could be expended by rates. I do know that the state has allocated additional payments during the period of COVID, so that might be expending a little bit quicker with multiple payments. We are reimbursed for that amount, but I may have to look at increasing that if these continue.
Okay. And 2 more down is Fond du Lac County Department of Social Services, 30, almost 33%. I believe, Jess, I believe that was going to end soon. That is invoiced through March. If you notice in the middle column there, we do have a few more months in with that one, but it's still trending to utilize too high.
That youth, it moved as of April 1st, so there will be a different
Perfect.
contract for the new placement.
Perfect. And then a couple more down from that, Positive Alternatives, 35% utilization.
That youth is only through June, I believe, as they will graduate and age out of care.
Okay, perfect. So sounds like the only ones we really need to look at for next month would be the Community Care Resources and the Children's Hospital of Wisconsin. So I'll be in contact with you about those. And I think that's it, Jess. You're not on page 2, so you can. If we flip to page 2. That's a lot of Lori Cooey's contracts, which we have not received the transfer as a pass-through of funds. A lot of times we haven't seen that yet for 2021. So we'll look at that next month. There should be some numbers in there. Page 3. Everything's trending okay, except 3 up from the bottom is Cornerstone Foundation, also known as Lucky Star 3, is at 27% utilization. I'll just be working with Miranda on keeping an eye on that. I think they did place an extra individual there recently. So that's another one on my list to talk about for future amendments. Page 4. About halfway down, Gene Warrior is at 17.4%. So not too worried about that, just tipping a little over that 17%. And then a couple down from that is Cario, which is at 23%, but they have billed us through March. So that should trend okay. Page 5, 2 up from the bottom is all that I was seeing. Tellurian is at 25% utilization. And I believe, yeah, it is only bills through February. So that's another one. I actually, every year, we always kind of watch that to see as it trends, if people are needing to use that service more.
And I believe that's our crisis stabilization, and they also do provide residential treatment for substance use.
So I'll add that to my list to keep an eye on. Page 6, that's just Winnebago is the only one that is tipping a little over where we should be. Any questions for me on contracts for 2021? And know that there are a lot more contracts and agreements. These are just the ones that tip over that $10,000 mark for monitoring closer.
All righty. If you have no further questions for Angie or anyone, I'll move on to approving our contracts, agreements, and amendments.
Yes,
Agenda
we have
item 9.
Yes, so we have 2 new ones for 2021. Artisan's Shop is, I don't know if I've seen Miranda on yet today. Everyone's pictures are so little on my screen. I don't think I've seen her.
Yep.
I'm here, Angie, but
There you are. Morning, Miranda.
Yeah, if you,
Mm.
I'm not as familiar with this one. If you know a little more about it, go ahead, Angie.
All I've heard is children's with disabilities and that they need to make some modifications on someone's home. That's all I've heard.
Okay.
And that they're really wanting me to get this as quickly as I can out in the mail. I'm sure with spring and vendors wanting to get working on some of these items. And then the second one is Lawrence Gallo Memorial Group Home, which is Jess. There she is. Go ahead, Jess.
Yeah, so I just spoke a little while ago about the Fond du Lac Secure Detention. So we've been able to identify a group home for that youth to transition out of secure detention into a group home placement in a community setting. So this would be that transitional placement that we've identified for them in order to get out of secure detention, which is a huge step for this youth.
All right, motion would be appropriate. We could approve both of these at the same time. Motion.
Make that motion.
Got a motion by Supervisor Glassbrenner. Is there a second?
I second that.
Seconded by Debbie Kaiser. Is there any discussion? My discussion would be, I see in parentheses on the Artisan LLC, modification LLC, I think, it says Laval. Is that a house that's in Laval, or is that company from Laval? And then is this using tax levy dollars?
It is not tax levy, it's CLTS, or Children's Long-Term Support Funds. And I think just the provider is in Laval, but it's a Richland County resident and client.
Okay. Is there any further discussions? All right, all those in favor signify by saying aye.
Aye.
Aye. Those opposed say nay. Motion carried. Is there another?
I think that's it for the contracts.
Okay. I went off on something else here on my tablet. So,
Personnel updates.
yeah, number 10.
Yeah, so we did fill that secretary position. This is the position at our main front desk with Annalee Winter. Annalee had been employed here at the agency previously, so we're glad to have her back. She'll have an easier time training at the front desk because she has some experience with that. And then resignations. Sadly, we do have to announce the resignation of Deborah Schwartz. Deborah had been hired as a temp casual escort driver just a few months ago, and I think it just didn't turn out to be a good fit for her. And as far as Southwest Workforce Development Board with our lease staff, we also hired Veronica Olson as an LTE confidential administrative secretary. She'll be working real closely with public health to help with coordinating and managing our vaccine clinic. It's really important to have a key person in that position and kind of get that workload off of Megan's plate, who's been working to help coordinate that. And then we also, unfortunately, have to announce the resignation of Laura Radeska. Laura had been hired in behavioral health as a mental health service facilitator, and she will end in April at the end of this month. And then I think as far as vacancies, we do have quite a few vacancies that we are advertising for that ADRC transportation escort driver. Behavioral health, we are continuing to try to fill a psychiatric nurse position. Also, we are recruiting for the APS crisis professional. That's the new position that we had established this year. We have interviews coming up. And also we have 2 vacant mental health therapist positions, and keeping our fingers crossed, because that's been a really hard one to fill, along with the psychiatric nurse position. We do have some interviews coming up for that. All other positions that we have that are on the county books are currently on hold. And that's because we had not budgeted for them. Does anybody have any questions about any of those?
All righty. Agenda item number 11, recognition of Deborah Kaiser for her years of service on the Health and Human Services Board.
Yeah, we put this on the agenda, you know, typically in times when we don't have to socially distance, we would have a cake. We don't have a cake, Deborah, but Debbie, I do have a certificate that we'd like to present you with, and I'll be giving you a call to figure out how we get this to you. It says, presented with sincere gratitude to Deborah Kaiser for her dedicated service to the citizens of Richland County as a member of the Health and Human Services Board from June 15th to June 2015 to April 2021. So thank you very much, Deb. We really appreciate
Thank
the
you.
advocacy that you've shown.
Thank you.
Yeah, thank you, Deborah. I want to just say thank you as a fellow board member for your service.
All righty. Thanks, Debbie.
Yeah.
Juan, looks like we have somebody else that has a letter of interest.
Yes, I did put in your iPad folders, Diane Cox, who you might remember is a former Health and Human Services employee. Diane has expressed interest in the position that will be vacant with Debbie's leaving. Diane was last employed as a county employee in February, I think it's February, double checking her. I think she retired February 2019. And she did come back as a lease staff to help with some training with our APS, our new APS staff who came into her position. And she also provided some supervision to staff getting their social work certification. So in the year of 2019, she did spend some time here at the agency assisting with those kinds of things. I believe that's the only letter of interest that we received. The letter went to our county administrator and he sent it over to us. I think when we had the last vacancy of a citizen member, this board at least reviewed it. And then we referred it back to the county administrator, who I believe now is the person with the authority to provide or to make appointments. I think he's also consulting with committee on committees for that.
So we don't need to approve this. This is actually appointed by Clinton, isn't it? And then it gets approved by the county board as a whole.
I believe that's right.
Okay. Well, is there any discussion or comments that people want to express over Diane? Okay. Then we got agenda item number 13, which is adjournment. This is a pretty quick Health and Human Services Board meeting today.
Fast.
Yeah.
We haven't had that in a long time.
No.
Mr. Chair, with the agency opening, I think the board has a choice. We can continue with the Zoom meetings. we can move to in-person meetings. However, we do have still maintaining a capacity limit on our meeting rooms so that we can socially distance. I think that room that we had been meeting in, it has a capacity of 16. And we would probably also have the ability to do a combination similar to what some of the other meetings are, where people can choose to attend via Zoom or in person. We certainly, if we had a large public showing, we could not accommodate a large number of people from the public into that room with only 16 capacity.
I'm in favor of having the next meeting be in person with masks and socially distant apart. Is there any objections to other committee members on that? I think that we would still need to have the option of doing Zoom also for our public to have access. All right,
Okay.
we'll plan that for our May meeting to be at the building in person. If that's okay with Rose, is it okay with Rose to do that?
Will it be at 10:30 then or at 9:30?
I would still ask to try to keep it at 10:30. We are having an emergency operations meeting every Thursday at 9:30 or at 9
Okay.
o'clock, I guess.
All righty. I would entertain a motion for adjournment.
Carrie, I would just like to add to, it still might be a struggle for me to get there right at 10:30, and I know that's been affecting quorum a little bit lately because we're running out of members. So I'm sorry, I will try my best to get there at 10:30. It's just really tight between the end of my class and getting to the meeting. So anyways, I can make the motion for adjournment.
Second,
I second it.
All right, we have a motion and a second. All
I
those in favor?
second it.
All right, we got a motion by Ingrid Glassbrenner, seconded by Debbie Kaiser. All those in favor signify by saying aye.
Aye.
Aye. Those say nay. Motion carried. Thank you, Debbie, for your service on the Health and Human Services Board.
Yeah.
thanks, Debbie.
Approve your
second it.
vouchers.
I can take those that they're done with me. I'm gonna add the stroke.